My name is John Grady Benson. It's a privilege for me to say that I'm the Physician-in-Chief at the Hartford Healthcare Bone and Joint Institute. I've been an orthopedic surgeon since 1990, predominantly doing joint replacement work, some trauma work. What's deeply personal to me is the relationship that I hope to have with you. And what I mean by that is understanding what you need for your life, what transforms your experience, what's important to you. There are all sorts of different options for care. My goal is to help you understand the information that you need, have a shared decision making about what your options are, never having you feel pressured into a decision, and having a discussion about what's important. Perhaps it's taking care of your grandkids, perhaps it's getting into a kayak. People have different needs. And so what I really want to do in healthcare is to make sure that you have an accurate diagnosis, they have information upon which to make a decision, and that I know enough about you so that I can help you make the decision for you. You know, most doctors would say, you have arthritis, you need a joint replacement, for instance. I try not to do that. Some people need that direction. You might need that direction. But it would be better to have a decision about it that you come to yourself. This is what your options are. This is what might happen if you had a joint replacement, for instance. These are the risks, and this is what I could expect. While we do that, we need data. And so it's going to be important for me to fill out certain surveys and to be involved in a data collection process. All of that is anonymous, but when we have enough data, then we can start to predict things for you. We can predict, for instance, how long would it take for you to walk after a joint replacement? What are the risks of the procedure? What can you expect a year from now? Will you be able to play with your grandkids, get in a kayak, climb a mountain? All those are the things that might be important to you. So I hope we can have a really good experience talking to each other and understanding what your options are. The other side of that is having enough data that we can do this digitally. So there may be times in the future where you have access to me and you have access to information, but perhaps you don't have the time to come to a geographical space, to come into my office and wait. I hate it when patients wait. I don't like to wait when I'm at the doctor. I hope I can make that better for you. Sometimes we get busy and sometimes we have to wait. So that's kind of who I am. All that stuff is really meaningful to me. And I hope you'll never feel that you have to make a decision when you're with me. I hope you can always feel like you can ask a question. There's no such thing as a silly question when it comes to your own health care. So I'm John. I hope I can see you soon. Thanks for checking in.